So good evening and welcome to the New York City Health and Hospitals Fiscal Year 2022 Virtual Annual Public Meeting for the Borough of Staten Island. Before we start the formal program, I do want to call to your attention that we do have interpretation services available. If you require these, you would call 212-788-3359 for Spanish, 212-788-3359 para Español. My name is Dr. Vincent Calamia. I'm the Staten Island Borough City Council representative on our board of directors. I want to thank you for joining us this evening, and I would like to introduce some of the other board members who are present this evening. Bob Nolan, who is our city council representative from the Bronx. Dr. Patricia Martone, who is our representative from Brooklyn. I'm not sure if she was able to make it or not, but Barbara Lowe from the Manhattan was also planning on attending. Sally Hernandez Pinheiro, and I do believe also Frida Wong and Piñasti Peñamora were planning on being here as well. I don't see them here yet, but and then our chairman of our board, Jose Pagan, and finally our president and CEO, Dr. Mitchell Katz. Also on our panel are Andrea Cohen, our senior vice president and general counsel. She's going to be our moderator for this evening, and Calicia Hercules, who is our secretary to the corporation. I'd also like to recognize the district manager, Sherry Diamond, who's representing Congresswoman Nicole Maliotakis. And I'm not sure if he's on, but Frank Mueller, legislative intern for our assemblyman, Charles D. Fall, 61st Assembly District. They are both participating in a listening capacity. I'd also, on behalf of the board, like to extend our thanks and acknowledge the wonderful leadership on Staten Island from our fabulous facilities, Seaview Rehabilitation Center, Mr. Matthew Levy, and Carrie Harewood, who was our regional administrator at Vanderbilt, and of course to the entire dedicated staff at those facilities who deliver amazing, exemplary service to our public health system and the people we serve. And obviously to all of you who are on board this evening listening, we'd like to thank you for the support as we strive to provide equal access to safe, affordable, quality care to all. And with that, I'd like to turn things over to our president and CEO, Dr. Mitchell Katz.
Thank you so much, Dr. Calamari. I want to begin by marking this 2 years from the start of COVID. We've lost so many people, friends, patients, colleagues. I don't know anyone who has not been touched and profoundly affected by COVID. I know there are many people in Staten Island who developed COVID, who became sick, who died, people who have recovered but are living with long COVID, and my thoughts are with all of them and recognize the challenges that they face. Health and hospitals during the second year of COVID spent much of our time on vaccines and testing, as well as dealing with additional outbreaks that occurred. Omicron was certainly the worst outbreak that we experienced in the last year. But I'm glad to say that case numbers have been decreasing steadily, and we were able to meet the need of our citizens and for treatment and for vaccination. Just to give people some sense of how heroic the staff of health and hospitals were, we provided more than 10.5 million COVID tests at our hospitals, Gotham Health Centers, homes of New Yorkers, and the test and trace sites, and have distributed over 4 million at-home tests. In January 2021, we administered our first COVID vaccine. By the end of March, we celebrated 100,000 vaccine. Since then, we've continued to prioritize vaccination for our employees and our most vulnerable patients, and have administered more than 1.7 million vaccines across the 5 boroughs. And I'm particularly proud that when we compared our performance to the other private hospitals, we had vaccinated a higher proportion of people of color. We recognize that especially within the Black and Brown community, vaccine rates have been lower, and I'm very proud that Health and Hospitals did a yeoman's job in raising those rates. We opened up 3 COVID-19 centers of excellence in Bushwick, Brooklyn, Tremont, Bronx, and Elmhurst, Queens, to serve people with long-term COVID symptoms. Through our contact and tracing effort, we identified 1.7 million contacts. We helped 33,000 people isolate in quarantine hotels. At one point, we were running 5 hotels so that people could isolate. To my knowledge, we are the only city to have created hotels so that people could safely isolate, recognizing that in this crowded city and that we love, people are often living in very close quarters, making it impossible to prevent transmission without moving people to another site. We walked people's dogs, we delivered their medications, we brought them food, we did whatever was necessary so that people could successfully isolate and not infect others. We launched the show vans, which are mobile units that offer services to over 119,000 unique New Yorkers. We have an aftercare program for people living with COVID. We've provided lots and lots of guidance to help our patients and all New Yorkers to know how to keep themselves safe. During this time, we have not forgotten our core missions of Health and Hospitals, and thinking about the borough of Staten Island in particular. We're incredibly proud of the work that happens at Seaview. It is consistently listed as one of the best skilled nursing facilities in New York State. It's a leader in quality care and compassion. We are so proud of all of the good work that goes on there. We also, at our Gotham site, opened a diabetes center of excellence at the Vanderbilt site, recognizing that diabetes is a very serious disease, but it's also one where the last few years have brought forth new treatments that are very effective. Some of the new injectables allow people to achieve better glucose control without the weight gain associated with the older agents. And we want to be able to offer those treatments to our patients. We're proud that we partner with 2 Staten Island community-based organizations, Make the Road New York and Project Hospitality, to conduct culturally sensitive and ethnically inclusive outreach to connect eligible Staten Islanders to our NYC Care program. This year, we celebrated 100,000 New Yorkers who were uninsured because of their immigration status. We, of course, are proud to serve them, proud to provide them the care that they deserve. Our program guarantees anyone, regardless of immigration status, that we will get them a primary care appointment within 2 weeks. And the program provides a full range of medical and hospital-based services, including pharmacy. And our Staten Island partners make sure that we get those people who most need it. So with that, I would just say, we're very proud of what we do. We're very pleased that we are in the borough of Staten Island, and we look forward to hearing the testimony that's to be given today. Thank you so much.
Great. Thanks, Dr. Katz, and good evening to those of you on the line. I don't think anybody joined us in the last few minutes, but just in case, I will remind you that if you require language translation service in Spanish, you can call 212-788-3359. Sorry, I'll bring the microphone closer, 212-788-3359. That is also the number that you can call up until 6:30 p.m. to register to speak. So we encourage you to please do so as soon as you can. We're looking forward to hearing from you. So we are gathered once again together virtually because of COVID-19, but hopefully not for too much longer, for the 2022 public hearing for the Borough of Staten Island. This is the very first one for this year in a series of 5 public meetings that we will conduct across the city's 5 boroughs. The purpose of the annual meeting is to inform the public on the programs and plans of New York City Health and Hospitals, and you just heard from our president, Dr. Katz, about those plans and programs, and then to give you, the public, an opportunity to present oral or written testimony about New York City Health and Hospitals performance. All public testimony, oral and written, and you are welcome to submit any written testimony, will be transcribed and forwarded to all the members of the Board of Directors, including those who are here tonight and those who were not able to be here tonight for their consideration. I'll be moderating the balance of tonight's meeting. And I will just very briefly highlight the format and rules for the testimony. The most important thing to understand is that this is an opportunity for our board members to hear from you, the public, about your comments, concerns, and ideas for New York City Health and Hospitals. It's not an interactive back and forth. We will just be receiving your testimony at this point. Each registered speaker will have 5 minutes of speaking time. On your screen, you'll see an electronic timer. We have that timer here today. Yes. That will provide a warning about the expiration of your time. It will be green for the first 3 minutes of your time. Will turn yellow when you have 2 minutes left. Will turn red when your time has elapsed, and it will start to blink, and I will gently interrupt you about 10 seconds after your time has elapsed and ask you to please quickly conclude your remarks. Anything that you are not able to squeeze into that 5 minutes, you certainly can submit in writing, again, by calling that same number, 212-788-3359, and they'll give you instructions on how to submit any additional written materials. All of it will be shared with our board. And I think with that, we are really looking forward to your participation and hearing from you. Again, please call if you'd like to register. And I think we have our first speaker, or we are going to wait just a moment for our first speaker, who is Joseph Tornello. Not yet on the line. So we will be reaching out to Mr. Tornello, and we'll just put ourselves on mute for just a moment while we try to reach out to him. Thank you. So while we are waiting for our speaker to hopefully return to the line, we will be waiting and up until 6:30. Anybody who would like to sign up to speak, please call 212-788-3359, and we'll get you right on the speakers list. Thank you. All right, well, we have hit the hour of 6:30 and we have not had speakers register. So we are just going to conclude this evening's event and say thank you so much for logging in. We appreciate your interest in New York City Health and Hospitals. Hope some of your questions were answered by Dr. Katz, and we will see you either next year or at our next borough. Thank you. Good night.
Good night, everybody.
Thank you.
Thank
Take
you.
care.
Good night.
Stay well.
Thank you.
Good night.
Appreciate it. Thank you.
Okay, we're good.